Welcome to Medcast Plus. I am your host, Dr. Jack Braha. Today, we are honored to welcome Dr. Susan Whitley, who is an addiction medicine specialist at New York City Health and Hospitals, Kings County here in Brooklyn. Welcome to the show, Dr. Whitley. It's really an honor to have you here to talk about addiction medicine.
Thank you so much for having me.
Well, before we start, tell us a little bit about what does addiction medicine specialty mean?
So there are really two ways to go into addiction specialty treatment. Some come through psychiatry and some through medicine, but really being an addiction specialist means you've done additional training, a year or two, to focus on addictions, identification and treatment of these disorders, and then made a decision to focus in that area. And
so after medical school, an interest in addiction medicine,
correct,
you decide to go into what we call residency and fellowship. How many years did you spend in training, and what kind of training did you do?
So I spent about 6 years total in training. I did actually both family medicine and psychiatry residencies, followed by a year of additional training to become an addiction specialist.
So really well-trained, super specialized here in addiction medicine. Where did you go to school, and where did you end up training after?
I did my medical school outside of the city at George Washington University, but then New York native, came back to do my residency in Manhattan at the Beth Israel Residency Training Program. Spent a year in the Bronx doing my addictions fellowship there, and worked there for a few years, and have been working at New York City Health and Hospitals, Kings County, for just coming up on 10 years now.
Wow. So Dr. Whitley is our New York native who did most of her training here in New York and is now practicing here in Brooklyn at New York City Health and Hospital, Kings County. So, really what we're here today to talk about is the opioid epidemic, and, really give us a view of what is the state of the opioid overdose problem here in New York City.
Right. So I think the reason that we're all here to say we're in the midst of an opioid epidemic is the startling overdose death rates. And like the whole country, New York City is in the midst of this epidemic. And to put that in perspective, the most recent data from the New York City Department of Health and Mental Health estimates that a New Yorker is dying almost every 6 hours from an overdose. That's more than motor vehicle accidents, homicides, and other leading causes of death combined. This is
four
really,
people a day are dying of opioid, and this is an epidemic in our city here. And as you said, it's more common than what we would really think of car accidents or other types of problems. Mm-hmm. So what is the state of affairs? How are we addressing this? What are you doing as an addiction specialist, and what is the city doing to take on this terrible problem that we have?
The city, through the Department of Health, and certainly where I am at New York City Health and Hospitals, is taking this on at full speed ahead. There's a lot of work to identify folks who have opioid use disorders, starting from the emergency room or other kind of places where people might enter the medical system, not necessarily for the purpose of seeking help for an addiction, but we need to make sure we're asking the right questions, screening for these problems, asking people about substance use. Really, no matter what the reason is, they're contacting the healthcare system. The second most important thing is trying to attach people to treatment if they do have a problem.
Right.
And another important initiative that I'd love to talk more about, is overdose prevention. We have extensive efforts at our facility and at other programs across the city to distribute naloxone.
So we touched on when people enter our healthcare system, when they get into the mix of things, is that screening them, no matter what they showed up for, whether it's to deliver a baby or maybe they lacerated a finger, to help screen people. What are we doing here in Brooklyn? What are you doing here in Brooklyn that is maybe unique to us here and at Kings County to help with this, as well as your naloxone program?
So one of the things that's interesting about Brooklyn is we have one of the lower rates per population of overdose deaths in New York City. But that, I think, is a little bit misleading because we have the second highest number per year compared to all the other boroughs. So last year, Brooklyn had about 265 overdose deaths in Brooklyn. There are certain neighborhoods that are at higher risk. So places like East New York, Williamsburg, Bushwick, Bedford-Stuyvesant, Crown Heights, and also Coney Island have higher than average rates of overdoses
Overdose of
compared to the rest
opioids
of
or
the city.
of all substances?
So
or-
the overdose rates take all substances into account, but about 80% of the overdose deaths do involve opioids.
And for
so
our-
we know that's leading
Right,
the charge.
and for our viewers today, when they hear the word
Yeah.
opioid, maybe they don't understand what that means. We're talking about which drugs here. What are some of the common names of the opioids that we might find on the street or in our prescription pill box
Yeah.
at home?
So there are basically two categories, I would say, of opioids. One is the sort of heroin and morphine and derivatives of those, which are sort of what we know of as drugs of abuse on the streets. The second big category, as you mentioned, are prescription opioids. So these are pills that may be prescribed for pain and become misused for various reasons. Those are things like Percocet. OxyContin has gotten a lot of press as one of the leading problems with the opioid epidemic as it's unfolded over the last few years.
And so these are things that we might even find in our cabinet that was prescribed, say, for someone else, or
That's
for
right.
us years ago that someone else can get their
Yeah.
hands on.
Yes.
So these are common drugs. Unfortunately, they've been very commonly used over the last few decades, which led us here. You mentioned naloxone a little while ago. Talk to us about naloxone, and is there a program for naloxone here in Brooklyn like we see advertised in other parts of the
Yes.
country?
That's a great question. Naloxone is an opioid reverser, essentially, and it's been
It's an antidote.
An antidote that can reverse an overdose on opioids. It's been used by emergency health workers and emergency rooms, EMTs, emergency responders, for a very long time. So when they arrive on the scene and someone is in an overdose, it can be reversed. What's changed recently is that naloxone can be made available to community members, friends or family members that may be concerned, or just someone who lives in a neighborhood and they think they might be in a situation where they could encounter someone who's in an overdose.
So lay people out there who don't have any medical training,
Exactly.
really. And how do they get their hands on the naloxone?
So there are various ways that you can get naloxone. One is by visiting a registered opioid overdose prevention program, and we at New York City Health and Hospitals, Kings County, are such a program. So being a patient there and coming in contact with a provider, we can get naloxone into anyone's hands who is requesting it. The other way is at local pharmacies. A participating pharmacy can dispense naloxone to anyone who asks, essentially, without a prescription. This is by an order from the New York City Health Commissioner to make it more readily available to folks who may not be attached to a provider or a program where
So
they
if there's
can get that.
a pharmacy in the boroughs that is participating by the order, someone
Yes.
could go get naloxone. Now, is
That's right.
naloxone a pill? Is it an injection? Is it a spray? How is it given?
So naloxone is available in various ways. The main way that we're just getting it out right now is in the form of a nasal spray. So it's like an allergy medication kind of pump that is administered through the nose. And that's, I think, one of the easiest ways and quickest ways to get it into somebody who's in need.
Now, for all of us in medicine, we've all used naloxone at one point in our lives, treating patients, whether we were in the emergency room or elsewhere in the hospital. It's an incredible drug. Tell us a little bit how it's going to work. If someone's going to spray it into a victim who has overdosed for some reason or another, what's going to happen once they spray it?
Well, the first thing is important to recognize the signs of an overdose. So that would be someone who is looking very sleepy, maybe breathing slowly. You shake them and they won't wake up, and then you can administer the naloxone. If that overdose is caused by an opioid, it should be reversed essentially immediately upon giving the medication.
Life-saving.
Instantly life-saving. And we do want people to still call 911 and get emergency help. This is no substitute for seeking professional help.
This is a
but-
life-saving, instantaneous treatment to get the patient to further care.
And in the minutes that it could take for an ambulance to arrive, you can reverse the overdose and potentially save a life.
So for our viewers today, what are some of the risk factors? I'll ask it two ways, I guess. What are the risk factors that someone might have that creates addiction? And what are some of the risk factors for overdose? Many people use opioids in our country for the correct reasons. They just had surgery. What are some of the risks that they become addicted to it and develop a problem with the drug? And what are some of the risks for overdosing on the drug, really the worst complication of it?
Right. So as far as risk factors for addiction, they're not, I don't know that they're not specific to opioid addiction, but we know that there is definitely a genetic component to risk for addiction. So folks that have family members or multiple family members that have had drug or alcohol problems, we know that their risk for these problems are increased.
Sorry to interrupt, but this is for our viewers to realize this is a disease that people don't choose. There's a genetic component to it, just
Absolutely.
like blood pressure or diabetes. Addiction has a genetic component, so that's obviously a risk for addiction. But what are some of the risk factors for the overdose that we all talk about?
So risk factors for overdose include using more than one drug is a common risk factor. I mentioned about 80% of overdose deaths do involve opioids as far as the last year's data show us, but often they involve opioids mixed with other drugs or alcohol. So things working together to slow the body's respiratory system. One of the main risk factors for opioid overdose also is reduced tolerance. So this is important to know because this could be someone who just came out of treatment, just came out of jail, for example, hasn't used drugs for a short period of time, and their tolerance is now lower, and they come back to their neighborhood and their usual lifestyle and use the amount that they were using before they went into that treatment episode or episode of abstinence.
I guess if someone was using 8 pills of whatever it is before they went into treatment because they had built up a tolerance from 1 to 2 to 6 to 8, and they've been off of it for a while, and then they go ahead and take 8 pills because that's what I was using before, they're not tolerant anymore, and subsequent an overdose.
Right. Yep.
And so we talked about some of these risk factors for overdose. What are some of the things that folks can look out for in their friends or family that they have a problem with opioids or other substances?
Well, the symptoms of the disease of substance use disorder are the same for any drug or alcohol for that matter. They have to do with how much and how often the person is using, but more importantly, they have to do with the impact on that person's life. Are they failing to meet their usual social obligations? Are they not showing up for family functions? Or is their work performance suffering in some way? Often there are physical consequences. Their mood may change. Maybe they're not sleeping well. And also specific health consequences. With opioid use, folks can put themselves at risk for liver infections, HIV, depending on how they're using the drugs. So there often are health consequences as well by the time folks are identified as having a problem.
And I know we hear a lot about on TV, as you mentioned before, about oxycodone, which is a pill, but there are multiple ways in which people can use or abuse opioids. What are some of the ways or some of the substances and how they can use them?
Well, with heroin, the drug can often be snorted through the nose or injected in a vein. Pills also can be taken by mouth and swallowed, but some people do crush them up and sniff them or even dissolve them in water and inject them. Those are ways of sort of increasing your bang for the buck. You get more impact from the drug by injecting versus swallowing it through your mouth.
I guess the stereotype of seeing people with track marks on their arms doesn't apply. You don't have to see someone using a needle all the time. They don't have to have the marks of injecting. Patients can just be using pills. You would never know. There's no physical sign of just swallowing a pill as opposed to a needle injection or sometimes snorting. And so family members out there, if they feel that someone has some of these signs or symptoms, which can be sometimes vague and indicative of other diseases, what are some of the steps they can take today watching and they have a friend or a family member they're concerned about? What can they do as the first step to maybe help out that person they're concerned about?
Well, we're putting a huge focus on helping primary care doctors, family doctors, internists, even pediatricians, especially those who are taking care of adolescents, to help them feel better equipped to identify folks who might be suffering from a substance use problem. Making sure that when folks are coming into a healthcare setting, that we're asking about substance use. As I mentioned before, no matter what the reason they walk through the door, these are questions we should be asking. So I think starting there and encouraging someone, if you're not sure what the problem is, to at least see their doctor and have a conversation about their health.
Just because someone missed work for a day doesn't mean that we need to, assume that they're an addict. There are other reasons for that, but there's a constellation of whether it's lifestyle impact that's going on that folks are worried about. What are some of the questions that one might ask in the healthcare setting, for maybe some of our viewers that are nurses or pharmacists or doctors out there? What are some of the questions that you like to ask to help identify?
So it's important to use validated screening instruments, and they are pretty straightforward questions. And for alcohol, the question, how many times in the last month have you had more than 3 drinks on one occasion, is a starting opening
straightforward, easy question to ask. Yeah.
Screening for alcohol use disorder. For other drugs, including opiates, it would be simply, how many times in the last month have you used opioids, other than as prescribed by a physician? And it seems like a very simple, almost silly question, but those have been studied and shown to be effective in terms of people are
And if you don't ask, you'll never know.
Exactly.
Right. So it's important for us to ask all of our patients these screening questions because there's help out there. And when we talk about help, patients always use the word detox. And, is that just a buzzword or is that really something out there? Is it something more formal? What is detox called in the medical world?
So detox is a method of treatment where people get withdrawn off of the medications that you're taking, particularly with opioids. Opioid withdrawal can be very uncomfortable. So most people cannot simply say, oh, today I'm not going to take any more OxyContin, or today I'm not going to use any more heroin.
So they need help
They do need help
to get off of this addiction. It's not just a cold turkey.
Yeah, most people don't do well with cold turkey.
They get very sick.
They get sick. It's like a really bad flu, nausea, vomiting, people can get dehydrated, very anxious.
So do they have to enter a supervised program, or how does it work when someone decides, this is it, I have a problem, I want to get help?
So we do recommend seeking medical help. Some primary care doctors are really well equipped to do this these days, and some people will end up seeing an addiction specialist like myself for this work. It doesn't really need to be done in the hospital for most people, so that idea of going into detox, I'll go for 3 or 4 days, they'll wash this out of my system and I'll be fine. Really, there's not great evidence that that's an effective way to address this problem.
But also it could be less disruptive if they're at home, able to do this at home with good supervision.
Exactly.
So not everyone has to enter a brick building somewhere where they're locked up or anything like this.
Absolutely
they can do
not.
this at home. And there are medications that have been developed to help with. And how do they work? How do these medications that we use for, opioid addiction and getting off of opioids, how do they work and help people?
So there are 2 medications that are approved by the Food and Drug Administration for this purpose. One is methadone, which has been around since the 1970s. We have lots and lots of experience using that, both to treat withdrawal and for treating people longer term, what we would call maintenance therapy. Many people benefit from staying on medication, not just for 3 or 4 days to clean out their system, but staying on medication for several months, even years for some people who are much sicker with their disease to get their life stable again. And then the second medication is buprenorphine, which has been around since 2001. And both of those work really by binding in the same place as the brain as the opioids that people abuse do, but then they stay there and they help to stabilize the brain systems that are craving the drug. So they relieve the craving, they relieve withdrawal symptoms, and allow folks to really focus on other treatment that they might need, such as counseling and therapy, and also to really function normally and go to work, take care of their families.
And so I know I've had patients in my office who, I think just by asking the question, we were able to identify, hey, there's an opioid problem here. And the concern always that I hear is, well, am I going to have to be on another medicine my whole life, or is this something where I can move on and not have to take another medicine? So is that true that they won't have to be on medications their whole life for some patients?
For many patients, absolutely, that's true. And I think the biggest thing to take into account, as you mentioned earlier, is that we are treating a disease here. And addiction is a disease that for some people does require long-term, even lifelong treatment. When we talk about asthma or diabetes, other chronic diseases, we don't necessarily expect to cure those in the course of a few days, a few weeks, or a few months.
Patients on insulin for diabetes, they need it more than 30 days.
Right.
This is a chronic disease, but there are some people, you were saying, that
and
won't need medications their whole life.
Exactly. And I think I love the comparison to diabetes, because we know some people with diabetes can change their diet, lose weight, exercise more, and then taper off of medication, and their body function is restored to normal. And addiction is very similar. There are some people with the right therapy, changes to their lifestyle, can then taper off medication and do great. And there are others who just do much better staying on the medication for longer time.
I think that brings us to that 360 approach to patient care, where we've been focusing a bit on identifying patients and treating them and maybe treating them with medications. But we know that 360-degree approach to the patient, counseling, supportive care, what are some of the complementary treatments aside from just taking medications for opioid addiction? What are some of the complementary and adjunct type treatments that are out there?
Well, counseling is a general term, and it's very important for most patients who are seeking treatment for opioid use disorder. Our programs at New York City Health and Hospitals, Kings County, offer various types of counseling, most offered by certified addiction counselors. So folks will receive individual sessions, group sessions, to really focus on the triggers for their drug use, ways to prevent relapse, things they need to change in their lives. It's very important for us also as treatment providers to look for what else might be going on. A lot of folks who come into treatment for addiction have complex things going on. They may also have depression or anxiety or things that have been kind of fueling the substance use. And so we want to be able to identify and treat those things at the same time as we're treating the substance use disorder.
And in your program, you have these services available to the patients to help treat underlying mental health disorders such as depression or anxiety or other issues that they present with.
We do. We have at our programs psychiatrists, psychologists, social workers, people who can really come alongside and work as a team to help folks get all of the services that they need.
So in addition to seeing you as a physician who specializes in this, there are other care providers that are introduced through the program. And if someone's out there watching today and says, listen, I need to get into your program, or I have a family member, how do they start to begin the process, whether they're coming to see you over at Kings County or elsewhere in our city? What do they do? What's the first step, really?
Well, I think it's first step is to have a conversation with your own doctor. And, the primary care doctor should be well positioned to help identify what's going on and make recommendations and connect folks to specialty treatment if needed. Many primary care doctors in the community are actually certified and able to prescribe buprenorphine, which is one of the medications that I mentioned earlier that is a treatment for opioid use disorder. And that's a nice thing that we can do now, is you can receive treatment perhaps in the same place that you're going for your other medical care without necessarily going to a
primary physician that you're comfortable with.
Yeah.
Because, now, if they want to come to Kings County, to New York Health and Hospitals, if they want to come to Kings County, how do they reach you? How do they find out about this program more?
Yeah, so there's a lot of information on our website, and that is www.nychealthandhospitals.org/Kings County. All of our doctors are listed there under addiction specialists. The main number for the hospital is 718-245-3131. Can direct folks to the addiction treatment specialty services there. We take folks on a walk-in basis, so Monday through Friday, 8 to 4, our doors are open, and we don't actually require an appointment for people who are coming in looking for help.
Yeah, it's nice to remove that barrier sometimes of, someone gains that motivation to start getting help on Monday, and they call for an appointment but have to wait. So your doors are always open on the weekdays for folks who decide that, hey, listen, I'm going to treat this problem. As you mentioned, a major problem here in our borough, a major problem here in New York City and across the country that we only touched on a little bit here in our time today. But it is good to know that our city is fighting this, that you're fighting this with specialists and with all of your incredible training, and that for the folks watching today, if they have somebody that they're concerned about and they want to keep some Narcan, naloxone around, which is the spray for the nose to, God forbid, if they need to use it during an overdose, they can go to a pharmacy that's participating, and without a prescription and with minimal training, I guess,
very minimal,
can save lives.
Absolutely.
And our cops are out there, are able to do this. Our EMTs are able to do this. Our ERs obviously are trained for this. Have you encountered any times when you've had to give this, or in your program, or have you seen this given before?
I'll tell you, over the last 6 months, we have our staff, not me personally, but my staff has reversed 3 overdoses on the premises of our program.
Amazing work.
And several patients that we've given naloxone to have also had the opportunity to go out and save a life in their communities. So it's very tangible, the
So
impact.
we're fighting this head on. Thank God for you and what you're doing at Kings County Hospital. And I thank you for joining us today. And I'm sure our viewers are interested in you a little bit more because you're such a wonderful doctor. We know you're New York bred and born here, and you've trained here. New York City, favorite pizza place?
So I lived in Greenwich Village for a long time, so I got to go with John's on Bleecker Street.
Okay. Are you a Knicks or a Nets?
I actually, not much opinion
Not
about
a basketball.
basketball.
Focusing on
I
medicine.
could, yes.
Okay. Yankees or Mets?
Yankees.
Okay, so she's a Yankee fan
Yes.
today. All right, very
No,
good.
every day.
Every day, okay. And, it's important to have you here. Thank you for making yourself more known to our patients and our viewers, and to getting to know a little bit more about you and opening up to us and teaching us more about addiction medicine and what you're doing at Kings County Hospital. Thank you for watching this episode of Medcast Plus. I am your host, Dr. Jack Braha. We hope you learned a lot about addiction medicine today, the use of Narcan and opioid addiction, and what you can do for your friends or family members, or even yourself, that are suffering from addiction. You can reach out to us at medcastplus.com, connect with us on social media, or reach out at 718-510-2103. And to all of our viewers, stay healthy. See you next time.